In this video lecture, we'll review the prevalence and course of the anxiety disorders that are included in the DSM-5. When it comes to the prevalence of anxiety disorders from the National Comorbidity Survey replication, this overall category is the second most common set of psychological disorders, coming in second only to substance-related disorders. And as you can see, the prevalence of the specific disorders included in this diagnostic category varies. The most common of these anxiety disorders are specific phobias. So about 9% of individuals meet criteria for a specific phobia in the past year, and about 1 in 8 individuals will meet criteria for a specific phobia at some point in their lifespan. Social phobia is also relatively common, with about 7% of individuals meeting criteria in the past year, and similarly about 1 in 8 people meeting criteria in their lifetime. There's some evidence that the performance-only subtype may be more common than the generalized subtype of social phobia. We see lower prevalence of panic disorder, with about 3% of the population meeting criteria in the past year, and about 5% meeting criteria in their lifetime. In the NCSR, they did not differentiate panic disorder with agoraphobia from panic disorder without agoraphobia, but as you'll see, agoraphobia without comorbid panic disorder is relatively rare. So only about 1% of the population experiences agoraphobia without also experiencing those other symptoms of panic disorder. And then finally, our generalized anxiety disorder, we see a prevalence of about 3% in the past year, and about 6% of individuals will meet criteria for a diagnosis of generalized anxiety disorder at some point in their lifespan. There are some common demographic risk factors associated with increased risk across the anxiety disorders. So for nearly all of the anxiety disorders, we know that women are more likely to receive a diagnosis than men. This includes all of our phobias with the exception of blood injection injury phobia, which we'll talk about later in this module. Women are also significantly more likely to be diagnosed with social anxiety disorder, panic disorder, agoraphobia, and generalized anxiety disorder. When we compare across countries and cultures, we see higher rates of specific phobias and generalized anxiety disorder in Western countries and in developed countries compared to Eastern and developing countries. And when we look at differences in the prevalence of anxiety disorders within the United States, we see some differences across racial and ethnic groups. So within the United States, members of racial and ethnic minority groups tend to have lower prevalence of social anxiety disorder, with the exception of Native Americans who don't differ from white Americans. They also tend to have a lower prevalence of panic disorder and generalized anxiety disorder. So one question that I want you to keep in mind about these demographic risk and protective factors is how our behavioral approach to thinking about risk for anxiety disorders and how these anxiety disorders develop and are maintained over time might help us think about some patterns that we see in these risk factors and some of the mechanisms that might lead some groups to be at higher or lower risk compared to others. So stay tuned for that idea. The course of these disorders varies somewhat disorder by disorder. So when we look at the typical age of onset for our anxiety disorders, we see the youngest characteristic age of onset for specific phobias. These often have their onset in childhood. Social anxiety disorder will often have its onset in adolescence. However, many individuals who develop social anxiety disorder have symptoms related to social anxiety earlier in childhood. So for example, they may be shy and they may not particularly like social situations, but often they don't meet diagnostic criteria until later in adolescence. Panic disorder and agoraphobia both are likely to have their onset in early adulthood. And of our anxiety disorders, GAD tends to have the latest age of onset with characteristic onset in mid-adulthood. However, any of these anxiety disorders can have their onset at any point in the lifespan. Across all of our anxiety disorders, we see a high prevalence of childhood anxiety. So regardless of the point at which an individual's symptoms exceed a diagnostic threshold at which they meet criteria for an anxiety disorder, many individuals with an anxiety disorder will characterize themselves as having been anxious for their whole lives. So they'll say, I was a worried child, I've always been a worrier, I've always had a lot of anxiety, it's just gotten worse over time. And these disorders tend to have a relatively chronic course with waxing and waning symptoms that often will increase or decrease in response to life stressors. So untreated anxiety disorders do not tend to naturally remit over time. So for example, compared to major depressive episodes, which will tend to remit over time even without intervention, symptoms of anxiety disorders tend not to improve over time without intervention, and they actually tend to increase over time. So they become more severe, more impairing, and more distressing over time without intervention, even though you may see fluctuations in the level of the symptoms in relation to stressors that individuals are experiencing in their day-to-day lives. We do see some evidence in epidemiological studies for a decreased prevalence in older cohorts. And there are a few different theories about why we might see this. So one is that this may actually be a developmental change, that as individuals with anxiety disorders reach later adulthood, that their symptoms of anxiety decrease, they may learn different coping strategies, their symptoms may improve over time. However, another possibility is that we may be seeing cohort effects. So for example, the individuals who are in an older cohort in a study may have grown up with different cultural expectations or norms around specific behaviors or emotions that might influence the likelihood that they experience anxiety or their willingness to endorse anxiety. And a final possibility is that we may see differential mortality. So for example, individuals with anxiety disorders may have a shorter lifespan or may experience greater mortality, which would lead to a lower presence of those individuals with anxiety disorders in older cohorts if we are doing a cross-sectional epidemiological study. So in general, when we are looking at the development of anxiety over time within an individual, we tend to see a chronic course of anxiety and an increase in anxiety over time. However, if we are looking at levels of anxiety across different age groups, if we're looking at those age groups at the same point in time, we will tend to see a decrease in the prevalence of anxiety in our oldest cohort of older adults over the age of 65.